And you're live.
All right, House Education, Tuesday, April 1st. No fooling around. We are the House Education Committee, and we are simply taking some time to discuss our agenda, not just for the week, but sort of in the weeks ahead. So for the committee, the bill we passed out now is being added to in ways and means. Some stuff is sort of directly applicable, like the foundation formula, and other stuff like property tax appraisal districts, not so much. But they're doing their thing. They're gonna go till Friday, like we had last week. Comes out there, then it has to go to appropriations briefly, and then it would be in the float on the floor. So we're talking the week of April 8th, I think, so I can see that happen. All right, so I have put sort of together a bit of a random bit of things. I just wanted to let you all know my thinking behind what's on the agenda now. So you'll see tomorrow, introduction to legal issues of redistricting. Just really want us all to have a good understanding of what that means. And this is not just drawing the big districts, but drawing the wards within them, which is really a gov ops thing, but it's important for us to understand like what's involved in that so we can be realistic about funding, time needed, et cetera. So we'll learn more about that.
Are we doing that with GovOps?
No, just,
Okay.
I think they will take it on in far more detail, but it'd be good for us to have a baseline understanding. We have, the deputy secretary, and Ann Guarnero from AOE coming in to talk, give us an update on the impact of federal changes. I think both are back from Washington last week with some new insight and information. 11:30 tuition in Title 16. This is sort of something, we had a bill from Elizabeth Burrows that talked a couple of things about tuitioning. For some non-districts that operate some districts grades and not others, the cost of tuitioning has sent them over the excess spending threshold, and that's tuition to public schools. And so I thought it would be good for us to have an understanding of how it all works. What is the average announced tuition? What does that mean? Does that apply to all schools? Does it apply only to independent schools? Does it apply to elementary schools? All that. So I thought it would just be good for all of us to understand that.
Be great.
I've asked the Superintendent's Association to set up some testimony in school districts where this has been an issue. There are school districts where they don't operate high school grades, so they tuition, let's just say essentially to public schools around them, but the public school tuitions are so high that it's sending them over the excess spending threshold. So I thought it'd be good to have an understanding of that so that if you choose to do something with it or just learn more later, we can. After lunch tomorrow, we've got sort of roles and responsibilities of school boards. Again, just to give us a strong baseline understanding so that at the point that new districts are being created, we're also creating new school boards and a good understanding of like what are the rules and responsibilities and roles of school boards. So that is what I have on the agenda and why. I just wanted to throw it open for the committee to discuss by yourself, because I'm leaving.
Talk among yourselves.
To discuss that agenda or to discuss if there's other things?
Other things.
Okay.
Well, I just sort of like, is there more people want to know
Yeah.
in those areas?
Yeah, we can take it a couple different ways, right? We can talk about, because obviously education transformation is going to be a topic for us for a long time from here on out until something happens. So we could take it down the road of taking testimony, knowing some other big topics about the transformation is going to come up. But we could also discuss other bills as well. So, it's kind of an open floor to consider some ideas. I know
I had a
And-
short list of things. Some of these are even carryover from last year. The sort of whole domain of therapeutic schools and access to those services for students in need. I routinely hear from parents in different parts of the state fairly desperate that there just aren't spots.
Right.
I know there's wildly varying tuition at some of the therapeutic schools, some alternative programs some schools have started. I don't have a good handle really on anything about that. I don't know that there's any a study of it in the bill that passed out of here. Policy solution per se, but it's certainly part of our special education cost issues. And I'm, also well aware there are students with high needs are not being met as well. I don't even kind of know I know we had a little bit of testimony on that, so I guess it'd be more of an exploration. I'm sure where it would go, but this has been on my list of.
So on that, you're saying that maybe you would want to start, and we don't have a bill obviously, so start a conversation around, maybe hear some testimony as to the challenges that the therapeutic schools. If that's the case, I might actually have some people from a therapeutic school.
Well, there's also the aspect of, right now, therapeutic schools are on a moratorium
Right.
from adding any more right now.
Right,
So
so
we
we
have to,
need to add.
correct, so do we take the avenue of, maybe, removing moratorium on therapeutic schools, or do we take the avenue of looking at how maybe a therapeutic environment can
Right.
be incorporated into the public school system?
Right.
Yeah, so,
Yeah, oh, go ahead.
well, I was just gonna say, I don't know whether you're intended to sort of broaden that at all, but I love that suggestion and wouldn't want it to be actually limited to the therapeutic school issue, but more, it's not like I'm trying to dive into 173, but the goal of 173 was to bring our students back into our schools. So it aligns with what you just said, Chris, about whether we can provide the services for our kids in our schools, because that's where so I love the idea of that. And I'm, pretty concerned about whether special ed in general, and it feels very threatened at every level, including federal.
Yeah.
And I want to make sure we're doing right by our kids.
Right.
So thank you for bringing
So,
that.
I would be not really sure where. This is sort of starting just building our understanding collective
Mhm.
IQ. I don't know what that.
Yeah, I was just gonna say, on the, absolutely, I just was talking to our district leadership last night, and Richmond's doing some really, well, MMU is doing some interesting things in our district about, supporting students in school, public school setting.
Yeah.
And I think they'd be happy to come in.
You can go first. I
Okay.
suppose, sir.
I was just wondering, and this is kind of maybe more your area, like, are many of these therapeutic schools residential? And if so, is there a certain portion of those kids that actually need 24/7? And some that we could deal with in schools? I mean,
As far as I know, most of them are just, like a typical school for the day.
they're just day schools.
Oh,
I'm sure
yeah.
I
there
think
are,
there's
I'm sure there
some-
are residential.
There are some, but there's
Oh, okay.
many more.
And I know with the Howard Agency, which is our agency up in,
Our center.
up in Chittenden County area, in the Howard Center. They have, they have the Barrett School, which is a sedate program, but they also have other pieces that could be more of a residential stay for a while or.
Okay.
For us, it's Kindle Farm. You probably, maybe you don't
I
care
guess
about
I've
them,
heard
but
of
Kindle
it.
Farm is in our area.
Okay.
Maybe more Wyndham than Bennington,
I
but
just know that probably at all the schools we can think of have very robust special ed,
Mhm.
as well as what we call access for the kids who are very challenged.
interestingly enough, the therapeutic school system that I just mentioned, Kindle
Yes.
Farm, they have made a connection to our designated agency as well. So they're sort of working under the same umbrella, which I actually really love. When I heard about that, when we first met with our designated agency this winter, after the election and before we got here, because, we all get to meet with our constituents. It was really interesting to hear from them, really interesting, and how the connection is very helpful.
Yeah.
So you just made me think of that. Thank you.
So, well, even we've had this discussion in my SU that like trying to bring more of the special ed costs, even for those outside placement back in-house. And I'm like, and I've had some really interesting thoughts on that. I also want to just make sure that we don't forget that if we do that, then we are running the risk of hurting the therapeutic schools that exist. And some of the, quite a few of them were started out of a need in the community,
Right.
not in some big agency, but someone who saw the need as a special educator and took the risk of going out, starting the school, putting in the time to get the education, invest in the facilities, invest in the trainings and all this. And if you sit there and, or if we sit here and we say, okay, we're gonna bring it all in the schools, at some point that means they're forced out, right? Or absorbed somehow. And that's, I don't think, fair to a group that has invested their life in a lot of cases into this. So I think we just want to be careful of not alienating or pushing them away, because I think that would be short-sighted and really not helpful.
I think that there's gonna be kind of different levels of this that are gonna be some that could be handled within the school system and stuff that still could not be handled within the school system. But we also were discussing that, though, remember that these designated agencies can access federal money if it's still there. In a way that public schools can't. So.
Yeah, I think it's sort of like starting a lane of inquiry and understanding. and
It sounds like we
building
want to
some
hear
flexibility.
more about.
Just to even understand the
Yes.
landscape as it exists.
Right.
And
All-
it's probably gonna
all
be
of it,
pretty varied.
Right, but
I
we
know.
can't do it without thinking about 173, because as much as I totally understand what you were just saying, 173 is actually a law that actually has a different goal than that. It is to bring our children back into school, identify them earlier, all of those things. So it's really important that we make sure that we're aligning with what's best for children, which is what that law was built on.
And can I just have a quick follow-up? Can you just maybe just give a real broad brush of Act 173?
I
Give that same chance.
It changed Act 173. I was talking about only the goals. Act 173 actually was the law that changed the way we funded special education too. So we went from, we went to a census block model, and that was a huge change. But in the process of all of that, that's where we started utilizing district management, schools and where we started to use and engage with MTSS and serve our children. Educators would speak about this better than me, but serve our children where they reside. And that is always the best place for kids to
Right,
educate
of
them as
course.
close to home as possible.
Yeah.
And frankly, the reason why we even took on Act 173 was because the costs were skyrocketing, and
Yes.
the costs were skyrocketing
Oh,
especially
I see.
because
how.
of
All right.
outside placements, because we were, as you all know, this
Right.
was even before COVID, but we were dealing with a lot more needs. And
Okay,
so anyway, it's worth going back and looking at the goals of
Okay.
173.
okay,
I'd say one of the other big changes is how a student ends up on an IEP.
right.
They have to go through that tiered
Intervention.
system of support.
Yes.
The teachers, the team
Yeah.
have to monitor and progress monitor what they
Yep.
have tried, how it has worked, what hasn't
Yep.
worked.
Yep.
In the attempt to have even
Lower those
lower,
numbers.
because a lot
Yeah.
of students, is it really a learning disability or a lack of instruction?
Yep.
That-
Gotcha.
And a lot of that happened during COVID
Yep.
too,
Sure.
because they
Yep.
were at home.
Yep.
So it's really start with really good core universal instruction,
Got it. Yep.
intervention, IEPs. My school where I taught had an in-house program, that the entire district actually used.
Okay.
But there were still some students who needed an outside placement.
Right.
It was beyond that.
Yeah, and I would like to know about that too, like why, at what point do you say we can't handle this?
Physical part.
I think we
Okay, so we have
Oh.
a yes, and we probably need to
But anyway,
figure out some
You
comprehensive
have-
kind of testimony
Yeah,
and
more on your list.
around the entire topic.
we need to know more about it.
Whether we can do anything this year or not, I mean, probably this will continue to be
That's true.
something important for us to understand for many years, okay?
You said you had a couple.
I do have a couple, but I could wait and let somebody else go.
No, we were waiting for yours.
The other one I would love for us to, again, really just kind of come from an understanding point is the community schools. We passed legislation 4 years ago. We used, money from ESSER dollars, 10 million, I think, to initially create that grant program. There's been a lot of innovative work in different places with that money. There's often this refrain of like supportive of the concept of community schools. There's a concept versus actual programs in certain schools that are being funded through the grant program. I think understanding better, as we hear about like repurposing schools or thinking about the future of schools differently or using space in schools differently, the idea of community schools comes up a lot. Could you also have medical, have a dental facility or a bunch of us visited Winooski a couple years ago. And they have services and things that are shared inside the school building that are not just education, they're health services, social service things. So I think, I guess I'd be interested, sort of a status check on like what we invested. And I think there's some people out there just dying to show us some cool stuff, great stuff that's happened in places, but what we've invested and then also what seems, the whole idea of the pilot program is kind of what's reputable, what is worth potentially, making more similar across our system or creating more, like what are the lessons learned from the pilots? And so I think we're still fairly early in that. That only started a couple years ago. So I don't know where it would go. I don't know again if it's any actual policy thing or funding, but I would love to understand. It's part of sort of us seeing things through too. Like my lesson of now into year 5 is that we often pass things in the legislature. And sometimes big things and put them out there and then move on to the next thing. And like, it takes to follow through to see how is something working? What does it mean?
I think even just some overall testimony on what community schools.
Even what they are,
Even
yeah, and I'm
like,
jumping
to-
ahead of it with my.
To kind of
Yeah.
bring us all back, because community schools, that term is used in different ways,
yeah,
right?
yeah.
So,
Mhm.
and
certain defined in the
Yeah.
bill. It's really feels like the right time to have that conversation since we're talking about transforming.
Oh, yeah, we're talking about
Education.
physical space and moving things and how do you maximize space and where do you use it, how do you, so,
And meeting needs.
yeah, again, might not have any
And-
concrete, like, end thing for us as a committee right now, but
Well,
building our collective
Mhm.
understanding.
One of our challenges that we're facing with this transformation is communities.
Yeah.
And this feels right to make that connection.
Yeah.
and how they might actually fit into the transformation.
Yeah,
right?
exactly.
I mean, at one point, it was one of the charges
Right.
that we just took away from the commission, and, when we gave them a list of
Oh, is that
10
right?
things to do, one of them was consider how the community schools model fit into the future now, and the bill we passed out. We took a lot of that back because it seemed like we had created a very ambiguous, enormous charge, but I think the spirit and interest of it still exists. I was just noticing that I get like updates from UVM. I just saw their UVM Office of Engagement, like their latest round of grants. So I was just reading through, curious where all the grants are. And there's a grant there for ongoing community schools partnership work. So this is obviously not from us. This is through UVM, but there's another whole part of that kind of higher ed connection that's come up with the community schools. So that would be part of something I would want to understand better. How are they advancing it? What can they do? So Annie, we can work on a whole list of other ideas, testimony,
Do you have any-
Do you have others?
do you have any more?
I have to go back to my list. An update from the commission on the future of public education. Okay, great. I was gonna say, and their public engagement plans. So,
Done.
okay, what else?
I'd like to see us talk about H54, self-run preschools. There were 49 representatives, which is almost a third of the body that signed on to that bill. We've received a petition with over 1,000 signatures. There's a ton of people on all sides of the conversation willing to testify. I know there's schools that have done it well. There's schools that are still trying to figure it out. There's, there's a nationwide conversation. And I think it's a good time to have the conversation, as tough as it might be. But I think there's a lot of great information to help us start moving in a direction, one way or another. But I'd like to see that come off
Yep.
the wall.
No brainer.
And then I'm gonna throw a controversial one.
Can't mention your own bills. I forgot to set those down. No, I'm just
It's
kidding.
not my bill. I don't think I have a bill on the wall. I might have signed on a couple. And there's people who've been contacting me, asking me to help get this, off the wall, H393, prohibition of requiring face masks in school. And no, that's a lightning rod of a topic for some, but I've been getting a lot of emails and questions to see if we can actually discuss that. There was some that wanted it in our, miscellaneous bill. So I didn't, that'd be something to actually at least start a conversation, or hear some testimony, or at least hear it be presented, so we can get more of that context behind it.
I'm obviously for free speech of any issue. I received those emails too, and a lot of them were just factually inaccurate. And I don't know of any schools that even require face masks at this point. So I'm not sure why we would invite conspiracy. And I'm not talking about the people that send you emails. I'm talking about the people that send me emails. Conspiracy theorists to spread false information on a rule that doesn't even exist.
I think the fear is to make it so the rule cannot be implemented.
But here's the thing, if we had another pandemic of the scope that COVID had at the beginning, we would have to require them at a certain level.
And that's where I think a conversation with both sides of the conversation and data presented would actually help to really quell both sides of this topic. So I bring it up because I am a sponsor co-sponsor on those as well as many others.
Yeah.
But I think it's because part of it is because it's a conversation I think needs to be had, and everybody's afraid to have a conversation. So I think it should come up as a conversation that is still present in our society and our regions at this time.
I wouldn't characterize myself as afraid to have the
I don't
conversation.
mean you, the people. in
Okay.
general, to be clear.
Yeah, I feel like at the level that schools would require them, it would be because at that point, it would be so medically suggested because of the level of a new pandemic.
I don't know that I would say I'd love to believe that that is the reason why, but I can see someone who's concerned about something saying, okay, we're going to a mask mandate, and with maybe some or no, a ton of data or no data behind it, right? It shouldn't be because someone feels like they want it. It should be because there's data to support the necessity of it if you're gonna do it. I'd love to have that kind of faith in all of humanity, but I don't.
Okay.
So I think that's why having the conversation to hash out, even if it turns into what then enacts us to be able to do it, or should we or should we not? I think it's just like having the conversation around the whys, the hows, and not leave it up to
Medical
someone.
professionals.
Sometimes it could just be an administrative decision.
Correct. So I've got that on the list, and this might be, what we just saw here, might be a reason why we don't really move forward with that. I'm not saying we are or not, but that will be a tough one.
Very much. a
Yes,
medical
but it's on the
thing.
list, and we appreciate you bringing it up.
Thank you.
Absolutely.
Peter comes
But
in.
again, right, perfect timing. And Leanne, thank you. I appreciate the dialogue. That's what I think we
The
need around.
dialogue is right.
Well, that's what we need around all these
You're
things. And if
welcome.
we
Yeah.
don't have the
I appreciate
dialogue,
it.
that's why I'm
Yeah,
talking about it,
yes,
right?
please.
So
All right, so thank
I
you.
appreciate that.
We're going out to the parking lot.
It's
It's gonna be a
landed, the
fight.
plane is landed.
Or crashed.
We
All right, other suggestions?
Well, I will just reiterate the cell phone free school. I have one constituent in particular who has reached out again to see if we have crossover, and the suggestion I was given to that particular person is that we had sent our miscellaneous ed bill over to the Senate. It could be added as an amendment. But if they don't, when it comes back over, we could. So yes, definitely cell phone free schools. I have also had people reach out about the face mask issue.
Mhm.
I don't expect that to actually be taken up, but it doesn't affect me, but I know it's been an issue that's been brought up by others, early college. So I know there were someone here I'd like to learn more about the impacts of early college. And were we gonna discuss the pre-K piece that we didn't get into the bill, maybe so pre-K, the other ends of the spectrum beyond K-12.
Yes.
I will need to check out, like, I'm not sure how much ping ponging a bill can do.
Yeah, I don't know.
So I need to check that out. So
That was what I suggested they add it. Maybe if we could add it over there before it makes its way back to us. We could get some more tests.
I think they have 4 bills on the wall down there.
Is that right?
Well, I was just looking at them to see what we had on here that wasn't specifically related to transformation.
And almost all of them are.
Almost all of them are, so just looking to see which ones, thought I just saw another one. Cardiac response,
So, we had decided,
yeah.
the chair had tried to lead the committee in the direction of letting the AOE's, student safety work, address it. It seemed like they had a handle on it.
I've had a few emails also on the hazing, harassment and bullying that was presented to us.
We can definitely take some testimony. That, if we can ping pong bills back and forth, the language of that is small and short. It's just adding a couple of people.
But even if we don't ping pong back and forth, is it something that could be done in January? In
Yes.
the new session, so getting the test.
Yeah, everything that's up there is still
Yeah.
viable.
Yeah. And another one not directly related, we haven't even heard at all, is about prohibiting artificial dyes in foods. Is that really our in school?
So here is
I'm just sort of looking at what was there.
so
Ruin
there
our
are 2
candy
bills
table.
that I'm going to ask about being relieved of.
Yeah, that should be.
That one is a food one,
Yeah.
and the masks is a healthcare one.
Yeah.
But, it's sort of like, if they're just gonna sit on the wall, doesn't matter which wall it sits on.
Okay,
Let's get it off our wall.
that's it for my list.
Some
Yeah.
other state just did something with the food dyes.
Yeah.
They
Yes, I was
did.
reading about
Yes,
that.
it was,
Can you
it
educate in schools?
was
West
Kentucky
Virginia.
or West
Virginia.
Virginia,
Virginia
yeah.
or West
They
Virginia?
banned all
All
dyes in
dyes.
schools this year,
Yeah.
Where?
West Virginia,
Yeah.
and I think by 2027, all stores are banning.
So that'll make a change.
It's huge.
Yeah.
Huge.
Yeah.
West
In
Virginia.
West Virginia, but coal dust is okay.
Yeah, you said this the other day somewhere.
I don't know.
Coming out of
Say
Diet
it.
Cokes though.
Oh, don't come for me.
It's an intriguing.
Hold dead hands.
Plus, that's very, very much in keeping with the current HHS secretary.
Yeah.
And everything's gonna be brown.
Talk about hard.
What was it? There was something that the FDA put out a year or 2 ago about added sugar in products that are in schools.
Yeah.
And there's like a 4-year, and that's gonna change the food industry, right?
Oh, yeah.
That,
Absolutely.
I'm big on making people healthy, but I
M&Ms
like
look
it
like
healthier.
dark color. Everything's gonna be.
Hey, those Sour Patch
Yeah.
Kids just will not be looking
Or
good.
natural color,
to just be clear.
clear Diet Coke,
I
Barkley
had
coming
to be
your way.
bummed about that.
All right, so what did I miss so I can express all my opinions?
Okay. The face mask
There's a
piece.
list of topics, not necessarily, one is a
Yep.
bill per se, but the others are really sort of
Takes-
understanding, deeper dives, some history, some sort of status checks.
Well, we have
You're
bills
missing
related
one.
to cell phone and
Everybody's talked about it going somewhere else,
So we got into it.
jurisdictional issue.
Couldn't resist
Which one?
the mask bill.
Oh, yeah.
That's what you
We've
want.
had a lot of constituents reach
When
out.
I
You
say
walked
the
right
point,
into it.
Yeah. I'm done.
And we'll move that to the appropriate committee if necessary. Which we should have done.
Thought about it. Have a lot of-
Yeah, we should.
Yeah, but we did
I want
great
to.
with that one.
Any other input? I know Casey wants off the wall.
But
I'd like to spend a little more time on H454.
That shook us.
H310,
It's a-
the anti-Semitism bill.
Mm. A lot of emails about that.
You had a few emails on it.
Couple.
Just a
One
couple.
or two.
maybe 100.
I mean,
Shall I play Van?
I don't know how everything works yet, but sort of,
Let me just interrupt and say, just like you have a list here, yeah, just like if there are things people want to learn more about.
Yeah.
I'd like to-
well, I guess what my thinking is if that comes off the wall, at least we can deal with it, and even if it's no, then it's done, and nobody can write emails about it anymore, because we've dealt with it,
Oh, it's
right?
still-
I'm sure they can.
It's okay.
I wouldn't.
Okay.
But it really could just be information, right? I mean,
Yeah.
like Turk
Yes.
said, it could just be.
I used to data to make.
I've also, on the agenda, I've invited, to the extent possible, that we can get the secretary in to really drill down into the details of sort of the timeline as proposed by the governor, but also just some of the absolute mechanics of like who does what when we're going through kind of the transformation process. Like, if we took sort of class size minimums, if they were hard and fast, like who's going to enforce those in these new districts?
Right.
And what do they think should be sort of the appeals process? We sort of worked within the existing system of EQS. But they may have other thoughts, because obviously that bill will be coming back at some point. But it would just be good to understand. As you may see, I'm a little concerned about timing and people's different opinions as to what's possible. And I don't want to sort of base it on my hunch, but I just want people to come in and talk to us about, like, how does it happen? How long does that take? And collective bargaining agreements, have I ever talked to you guys about how I'm concerned about collective bargaining agreements?
A few times.
No.
Yes.
Speaking of sort of like things to go back and revisit, did the agency say in response to a request, I think a couple of us have had about, sort of what, district consolidation or sort of, streamlining might look like in a real world context? Did they recently give us
You talking about
documents?
specifically the budgeting?
I think so, like there's a couple of things that came in recently that I think were responsive to a request from a while ago that maybe we've been pretty head down on
Yeah.
before. I guess there might be something.
Yeah.
There might be some things.
If you want to
about there.
follow up
Yeah,
with Lindsay or whatever,
Okay.
see what's available, what could be, both give you some testimony on it.
maybe Annie can do that.
Unrelated but related, I had asked quite a long time ago and received, the org chart for the AOE. And I think, someone, maybe it's you, Janet, was kind enough to print them all out for us. But as soon as I took a look at the printed out version, I realized something was wrong here because all the employees many of the long-term employees were listed as temporary. And so I did reach back out to Lindsay and it appeared, I haven't had, because this was just before last week and didn't have time to even talk to her, but it appears that on that org chart, some of those were supposed to be gray. And I don't know how this works because there was no gray in the scale either. So I'm not even sure. So at some point, I'd love to have the agency explain the org chart and get us an updated one that is actually accurate. Because it's clear that this one, not their fault. I'm sure they meant it to be accurate, but it didn't show up on the chart in the right color when it was printed out. So I'm not sure how many temporary employees there were in there. And I think it changes pretty regularly too. So anyway, love to get a better understanding.
I think that we should prioritize what we hear based on how lonely we feel it when we're in the room and if we want to draw a crowd or not.
I think 310 will bring them in.
Yeah. I think so.
I'd say it has
So
one.
face
mask.
That'll bring them in, too.
This room, I don't think temperature has anything to do with human bodies.
Oh.
And we do have windows.
It is warm in here today.
As long as it gets-
Danny's.
All right, well, if the level of discourse is only going to go downhill, then why don't
We can be hopeful.
close for now?
Emily can get that.